Good morning and thank you for attending. Today I'm joined by Dr. Carol Zimbalati, public health physician, to give an update on our local COVID-19 situation, and Andrew McClellan, Director of COVID-19 Immunization Strategy, will provide an update on the vaccine rollout. Before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I'd also like to acknowledge the Métis historical presence in the region. I encourage everyone to continue your journey of learning as we can work to contribute to the process of reconciliation. Last week, the province launched enhanced vaccine certificates with the QR code and the Verify Ontario app for businesses. These tools intend to make it easier to check for valid proof of vaccination where required. With enhanced vaccine certificates now available for all vaccinated Ontarians to download, many people across the province have been logging on to the provincial website over the last few days, causing some delays for individuals looking to immediately download the QR code. If you have not been able to successfully download your enhanced vaccine certificate, please be patient and try again at a later time. Your previous vaccine certificate, also referred to as a vaccine receipt, is still valid. Individuals who would like to have their enhanced vaccine certificate mailed or emailed to them can contact the Provincial Vaccine Contact Center at 1-833-943-3900, or you can call our COVID-19 call center at 1-844-478-1400. We would like to remind businesses to download the Verify Ontario app by October 22nd, if able to do so, and continue checking pieces of ID upon scanning QR codes as proof of vaccination. Also, over the past week, updates have been announced regarding travel between Canada and the United States. As of November 8, individuals who are fully vaccinated will be able to arrive by car or boat to the US for non-essential purposes without having to complete a COVID-19 test. Proof of a negative COVID-19 test, either a rapid antigen test or molecular PCR test, as well as vaccination, is still required for fully vaccinated individuals flying into the US. And a negative COVID-19 test, molecular PCR test only, is still required to return to Canada at this time, whether you're arriving at a land, sea, or air travel borders. It has also been confirmed that as of November 8, the USA will accept travelers with a mixed vaccine series, and that includes Pfizer, Moderna, AstraZeneca, and its counterpart Covishield vaccine, aligning with their reopening of the land and water borders. Soon, many people will be celebrating Halloween. It's very important that everyone consider the risk when making their Halloween plans. No matter if you're going door to door or to a Halloween party, there are many ways you can reduce the risk of COVID-19 while still having fun. If you're trick-or-treating, stay home if you have any symptoms of illness, even if mild. Trick-or-treat only with people you live with. Wear a face covering when trick-or-treating. If possible, find a Halloween-themed face covering instead of a costume mask. Costume mask is not a substitute for a face covering, and is not recommended that they be worn together. Only trick-or-treat in outdoor settings. Avoid congregating in small spaces, doorsteps, to collect treats. Wait from a distance until the group before you has cleared. Keep interactions brief with people handing out treats. Sanitize your hands often while out trick-or-treating, especially when you return home. If you're handing out treats, do not hand out treats if you have any symptoms of illness or even if they're mild. Sanitize your hands often. Use tongs to hand out the treats. And do not put out a communal bowl of candy for children to grab from. Only hand out individual prepackaged treats. If you plan on attending a gathering or hosting a gathering and start to feel symptoms of COVID-19, cancel, self-isolate, and get tested for COVID-19. Wash your hands regularly and use a hand sanitizer often. And if possible, host the party outside. If inside, we encourage you to ask individuals who are not vaccinated to wear a face covering. And please ensure that you follow the provincial gathering limits of 25 people indoors and 100 people outdoors. By working together, we can continue to reduce the spread of COVID-19 and keep our communities healthy. So with that, I'll pass it on to Dr. Carol Zimbalati to give a local COVID-19 update.
Thank you, Dr. Chirico, and good morning. In the last 7 days, we had 7 new cases, bringing our total case count to 798, with 560 in the Nipissing district and 238 in the district of Parry Sound. The health unit currently has 10 active cases. Currently, there are 2 individuals in hospital due to COVID-19. Since June 1st, 64% of individuals eligible for the vaccine who tested positive for COVID-19 were unvaccinated, while 21% were partially vaccinated. 15% of cases have been identified as breakthrough cases, meaning individuals who have tested positive for COVID-19 were considered fully vaccinated. At our last press conference, we mentioned the outbreak at a faith-based community within the health unit district. Today, we are declaring this outbreak over, as there have been no additional cases associated with the outbreak in the past 14 days. On October 19, we declared a COVID-19 outbreak within a workplace setting. Through the outbreak investigation, it was determined there is currently no risk to the public, and those at risk have already been contacted. As such, we have not issued any public communication on this outbreak or identified the specific workplace affected. A news release for a workplace outbreak will only be disseminated when it is difficult to complete case and contact management, or when there is a risk of exposure to the general public. The outbreak information is shared on our status report on our website, which is updated Monday to Friday at 3 p.m. At the beginning of the school year, the provincial self-screening tool for school was updated to include only the most commonly experienced COVID-19 symptoms on the screening checklist. I would like to remind parents, guardians, and students that anyone who is sick or experiencing any symptom of an undiagnosed illness to stay home and seek an assessment from their healthcare provider if needed, even if their specific symptoms are not listed on the screening tool. This is helpful for preventing possible spread of COVID-19, as well as other illnesses, such as the common cold and flu, which can be transmitted within schools. Now back to you, Dr. Chirico.
Thanks, Dr. Zimbalati, and I'll pass over to Andrew McCollum to give us an update on our vaccine rollout.
Thanks, Dr. Chirico, and good morning, everyone. As of 3 p.m. yesterday, we are now at 86% of our residents 12 years of age and older who have received at least 1 dose of a COVID-19 vaccine, and 81% of residents 12 years of age and older who are fully vaccinated. Currently, the age group with the lowest vaccine rates are those aged 18 to 29 years of age, with only 73% who have received at least 1 dose and 64% who are fully vaccinated. That means 27%, or about 1 in 4, have yet to receive a dose of COVID-19 vaccine. If you know someone in this age group, I encourage you to have a conversation with them about being vaccinated. They can also call our call center at 1-844-478-1400 if they have any questions. 72% of youth aged 12 to 17 years of age have received at least 1 dose of COVID-19 vaccine, and 81% have received both doses. As of yesterday at 3 p.m., a total of 190,848 vaccines have been provided within our district. The current target remains to achieve 90% vaccination rate for both first and second doses. To achieve this rate, we need to administer 4,633 additional first doses and second doses to those without a vaccine, as well as 10,633 second doses to those who already have received their first vaccine. Individuals who are eligible for a 3rd dose of COVID-19 vaccine are able to receive their 3rd dose at one of our clinics, provided they bring the proper documentation from their healthcare provider and the recommended amount of time has passed since receiving their 2nd dose. A list of 3rd dose eligibility criteria is available on our website at myhealthunit.ca get vaccinated. For eligible immunocompromised individuals, the interval between a second and third dose is 8 weeks. Residents of long-term care homes, retirement homes, First Nations, elder care lodges, and individuals living in elder care settings need to wait 5 months between their second and third dose. These individuals can get vaccinated at a private clinic held at their facility or attend one of our upcoming clinics if they are able to do so. In addition to the COVID-19 vaccine rollout, we are now also focusing on influenza vaccines. Flu shots will be available to the public starting November the 1st. Individuals looking to receive a flu shot should make an appointment with their doctor or primary care provider or visit a pharmacy. You may also walk into a flu shot clinic put on by the health unit. Our flu shot clinics are as follows. November the 3rd, Magnetawan Municipal Office from 3 till 5 p.m. November the 7th in Parry Sound at the Stocky Centre from 10 till 2 p.m. November the 8th in Mattawa at the Mattawa Golden Age Centre from 2 to 5:30 p.m. On November the 10th in Sturgeon Falls at the Marcel Noel Hall from 4 till 6 p.m. And on November the 13th in North Bay from 9 till 5 p.m. at the Elks Lodge. Flu shots are safe to receive together with the COVID-19 vaccine, so you can get both your shots at one time. Appointments for flu shots will also be offered in health unit office appointments beginning in November. Please call 1-844-478-1400 to book your appointment. At this time, we are looking into the ability to offer flu shots at our COVID-19 clinics, and we'll provide further information as it becomes available. And now back to you, Dr. Chirico.
Thank you, Andrea. And that ends our remarks. So we'll take questions now. You can type them in the left of your screen, and please associate your name if possible. And I'll turn it over to Alex.
Thank you. So our first question is from Eric Tashner from CTV News. With the release of the QR code, how can seniors without cell phones go about getting theirs and prove they are vaccinated? Are there places in the city where seniors can print their code? Dr. Chirico?
Yeah, you don't necessarily need to have a cell phone for that. You can download, if they have access to a computer, they can download the piece of paper that validates their vaccination. And if they don't have a printer, the health unit would be happy to help you out. Give us a call and we can have it ready for the next day. We're still doing that. So I don't know about any public areas that have it, but we can certainly help you out.
Thank you. Our next question is for Dr. Zimbalati. It comes from Jennifer Hamilton McCharles from the Nugget. Where can travelers get a rapid antigen test, and is there a fee?
Thank you, Jennifer. So I do believe that there is a testing site available in North Bay called North Bay Rapid Screen, and that is available for travelers needing a PCR test. Yes, there would be a fee for that, but I'm not sure what the actual rate is. It's best to check with that service.
I'd also like to thank you, Carol, for that. Please don't use the assessment center, the testing centers for travel related. There are capacity issues and it needs to be reserved for those that are really symptomatic. So we just ask that people comply with that and not go there for travel related testing.
Thank you. And a follow-up to that, Dr. Zimbalati, from Jennifer Hamilton McCharles from the Nugget. How far in advance do people need to get their testing done when traveling?
Actually, I'm not sure of the answer to that. Perhaps Dr. Chirico is aware.
Sure.
Though
it's 72 hours.
Sure.
It's 72 hours. And the other thing is that if people are just going back and forth across the border, you only need the one test if you're coming back within that 72 hours. And again, you don't need the test if you are driving over into the United States it's just the main test would be required if you're going into the States, if you're flying, and you have to be fully vaccinated, and that's within 72 hours.
I would add that it's always prudent to check the Government of Canada website for any changes in terms of requirements for pre-travel testing, as well as the website for your destination country, because those requirements can change.
Thank you. Our next question is for Andrea. It comes from Jennifer Hamilton McCharles from the Nugget. Is the health unit anticipating a large uptake this year in the flu vaccine? And is there enough for the anticipated demand?
Hi, Jennifer. Thank you very much for that question. It's hard to predict what the uptake will be. We're certainly promoting the flu vaccine, and if our call volume that we're starting to see with people asking questions with respect to flu vaccine is any indication, I expect that there will be a fairly high uptake of vaccine. As far as supply goes, we have no concerns at this point in time with respect to having enough vaccine to accommodate anybody in our district who wishes to receive their flu vaccine.
Thank you. Our next question is for Dr. Chirico, comes from Brad Obing from Vista Radio. With North Bay Regional Health Center's 21 critical care beds and 12 beds, which can be designated specifically for COVID-19 treatment, can we expect more patients from out west as they battle their fourth wave of the pandemic?
Yeah, I think that that's certainly a question that should be answered by the hospital. However, what I can say is that the hospital has been really helpful to provide support for not just other provinces, but for other jurisdictions in our province. We all help each other out because certainly if we're in a position where we need to transfer patients or need specialized care, everyone is always very willing to help out. So I do anticipate that there may be more requests, and depending on the capacity of the hospital, that would be for them to determine whether or not they have the ability to accept patients. But they've done an amazing job to certainly help out whenever they've been called upon.
Thank you. Our next question is for Andrea. It comes from Jennifer from the Nugget. How long does the health unit anticipate it will take to reach 90% of the vaccinated status?
Thanks, Jennifer, for that question. It's difficult to specifically determine a date on when we think we'll achieve that 90%. We continue to see an increase in the number of individuals who are coming to receive their first dose. We're certainly seeing that steady flow on a weekly basis. We're also continuing to see people coming for their second dose. So I think, you know, we're continuing to promote the vaccine. We're continuing to try and make it as easy as possible for individuals to receive their vaccine. We're working with healthcare providers and pharmacies to provide access to the vaccine. And so I think the goal is achievable. I would hope that we can achieve that sometime by mid to late December.
Thank you. Our next question is for Dr. Zimbalani. It comes from Jennifer from the Nugget. I understand the health unit and school boards have agreed to allow spectators to attend outdoor high school sports. Are there capacity limits, and if so, what are they?
Thank you for that question. So provincial requirements on capacity limits will have to be maintained in terms of spectators for high school sports, and individuals are asked to still physically distance from others not in their household. But for many outdoor sports venues, there aren't any specific capacity limits at this point.
And I'd like to add, thank you, Carol, for that. And I'd like to add too that there is a screening procedure before you go to the event that you can take, as well as scanning the QR code that is available, so that your personal information, your name, it's just more for, it's not medical information, but it's just contact in case that there was an issue. And you can scan the QR code, fill in beforehand, and so because the school boards are responsible for that contact information, and it's easy enough to do, It's just an added protection. The other thing is that they require masks to be worn within the venue as well. They've done a great job to try to keep everything as safe as possibly can be expected.
Thank you. Our next question is for Andrea. It comes from Rich Coffin at Vista Radio. With Pfizer submitting the vaccine to Health Canada for use for 5 to 11-year-olds, is the health unit preparing for vaccinations for this age?
Thanks, Rich, for that question. Yes, we are in the process of planning for that age group. It's been anticipated that the announcement will come in 6 to 8 weeks with respect to the availability of vaccine and the approval if it's approved. So we've been working with our local school boards, with some of our local community agencies such as One Kids Place and HANDS, and primary care physicians and pharmacies as well, to set up processes to support the delivery of vaccine to 5 to 11-year-olds across the district.
Thank you. So that completes all of our submitted questions for today. So that will end our press conference, and we will meet back in 2 weeks on Thursday at 10 a.m. Thank you.